So we have a patient that comes into our facility for our first appointment, and upon reading their medical charts, we see that the patient is 56 years old and has been diagnosed with myocardial infarction and has recently had bypass surgery. So we look down the medical history and see that the patient is on a long list of cardiac drugs, including a diuretic and an emergency vasodilator. So let's talk about some precautions we need to take while treating this patient in an exercise facility, and what we expect exercise tolerance to be with this patient. Let's also look at some of the cardiovascular effects of exercise. So we also see, or like we just talked about, we see that he had a heart attack, which we know this is going to decrease exercise tolerance. His heart cannot drive as much blood out as it once did, so cardiac output will be decreased. We also know once you have your first heart attack that you're also more at risk for another one, so that's always something we need to think about as well. We also see they had bypass surgery, and assuming that he had this surgery because of atherosclerosis, we also know he suffers from high blood pressure, since hypertension precedes atherosclerosis. So to treat hypertension, he was placed on a diuretic. So diuretics increase urine output and sodium excretion by the kidneys, and in return, this will drop blood volume, leading to a decrease in preload and stroke volume. Overall, this will decrease cardiac output and limit his exercise tolerance. So while dealing with this patient, we need to have a restroom on hand because he will be excreting fluids, but we also need to be aware that he is losing these fluids and electrolytes, making him at high risk for dehydration. So as he's in our care, we need to make sure that he's well hydrated and replenished on electrolytes. We also know that he was placed on an emergency vasodilator. Before administering any type of exercise, we need to make sure that this patient has that emergency vasodilator on hand. And this will be administered if he has any kind of symptoms of heart attack or inguinal pain. So we need to be aware of these symptoms while dealing with this patient. So symptoms like chest pain, pain in the neck and shoulders, dizziness, fatigue, weakness, shortness of breath, anything like that we need to know of so we can be aware when he is about to have an inguinal attack or heart attack. So when this is given, it's usually given sublingually, and the coronary arteries dilate and oxygen delivery to the heart increases. So it will alleviate that pain. So if any symptoms arise, we need to stop exercise and administer this drug. So in return, this will decrease afterload, which will increase stroke volume and ejection fraction, and therefore decreases preload. So like I said, we need to make sure that this patient always has his emergency vasodilator on hand before administering any type of exercise. We need to make sure there's a restroom at hand as well, because he is going to be excreting fluids and electrolytes. And we need to make sure that he's being replenished and well hydrated throughout the whole entire training session and beforehand.